Hi, everyone. My name is Andy Burstein. I am the co-founder and CEO of Accessible Pharmacy Services for the Blind. For those of you who are not familiar with us, we are a home delivery pharmacy service in the United States. We specialize in patients who are blind, deaf-blind, and have low vision. We are the only provider of its kind, and we are the largest blind-owned healthcare company in the country. So thank you so much for including me today. And I'm looking forward to sharing some of our findings, share with you some of the things that we do. And everything that we do is really focused on merging healthcare and accessibility and empowering our patients to manage their medication, manage their diabetes, and do it in a way that's less stressful, that promotes greater independence amongst the patients, and ultimately empowers them to live healthier lives. Blindness and low vision impact over 282 million people globally. And that number is only increasing for a multitude of reasons. In the United States, one of the biggest reasons is the growth of diabetes and the challenges related to managing diabetes, which ultimately leads to diabetic retinopathy. But similarly, other causes are also increasing the volume of eye disorders and loss of sight, glaucoma, macular degeneration, cataracts, and so on and so forth. As I mentioned, who we are. I founded the company with my business partner, Alex, and my business partner, Jason. Jason has his doctorate in pharmacy, and he actually leads our medical team and really focuses on how we can provide the best medication and diabetes care to our patients. Alex has a PhD in marketing. Alex lost his eyesight when he was a teenager. He is completely blind now. He has a condition called retinitis pigmentosa, which is an incurable degenerative retinal disease. Our companies, because we're the only ones who do what we do get a lot of acknowledgments. We've been featured in some of the premier American news publications and television and radio programs. We've been awarded a multitude of awards. It's not that we need awards, but it is nice to be acknowledged by leaders in the disability and healthcare community. So we actually won the federal government's award, the FCC Chair Award for Advancement in Accessibility in Healthcare. And it was basically us and Apple Computer were the two winners of that award. We won the Helen Keller Services Accessibility Award. The Helen Keller Services is the national organization in the United States that focuses on deafness and blindness combined. And we won the Henry Viscardi Achievement Award. The Henry Viscardi Center is a network of centers throughout New York that focus on people with a full range of disabilities. And it's arguably one of the most premier organizations in the country. And they have a multitude of programs ranging from residential living, job training, rehabilitation therapy, and so on and so forth. So we were greatly honored to win those awards. As you can imagine, being blind, all the challenges that accompanying being blind, it's intense. It's very difficult. And when you layer in medication management to that, things that we take for granted and how we manage our medication become much more difficult. So these are a few things that we bump into. Just not having eyesight and being able to identify pills, I read warning labels and instructions, to know a medication's expiration date, to fill a syringe or pour liquid, monitoring glucose and managing the whole thing of diabetes, understanding drug interactions and side effects, understanding nutrition and medication interactions, to be a parent who is blind or a grandparent who is blind, to safely administer medication to children, to make sure you're taking the correct medication, to organize medication, to coordinate refills, prescription renewal, interacting with insurance companies, and just dealing with a pharmacy in general is incredibly stressful and challenging. So all the things that we do are designed to minimize the challenges for each of these tasks. We find that the concept of universal design, the concept of building your model as properly and building your model being our pharmacy model, building it to be as accessible as possible to everyone. And this is a work in progress. But we found that by building the model the way that we did, where we focus on personalized medication, where we focus on saying, who is this individual? What are their challenges with managing their medication? And let's build solutions for that individual. And just by doing that, we find that other populations end up gravitating towards us and embracing us to be their pharmacy provider. These include patients who are deaf, patients with spinal cord injuries and extreme mobility limitations. So, for example, for someone who has very limited use of their hands, to be able to open medication packaging. Patients with cognitive and intellectual disabilities. We have a huge growing collection of refugees and asylum seekers who are just learning about the medication model in America. And obviously seniors who benefit from home delivery, our packaging, our labeling, et cetera. When it comes to packaging, everything that we do that makes us accessible, there's no charge for. We make our money by being reimbursed by insurance companies. In the United States, the insurance companies will pay for a patient's medication. So we provide accessible packaging. We have individual daily packets. It's essentially a 2-inch by 2-inch plastic baggie, and we can sort within it prescription medication, over-the-counter medication, vitamins, and supplements. We also have disposable pill organizers. So rather than someone getting their pills in bottles and having to sort it in an organizer, we send them compliance packaging already pre-sorted. And as I mentioned, we have a wide range of collection of bottles, traditional small bottles with childproof lids, but also oversized bottles with pop-off lids to help people that may have arthritis or Parkinson's, or just have a difficult time opening up a package. On top of all of our packaging, we have a whole collection of accessible labeling. So we have different kinds of Braille for those who would benefit from Braille. We have text labels, so we can print traditional labels in text. Right now, we do primarily Spanish and English, but we just upgraded our software to be able to do 200 different languages. We can also print these labels in large fonts. So for those who have like low vision or poor vision, they're able to see labels with large size letters. We also have audio labels. These are labels that read medication information out loud when using a device or an app. So Script Talk is one of them. Way Around is one of them. We don't prefer one or the other. It's all patient-centric. We let the patient, our goal is to educate the patient on all the different solutions that are available and then provide them with those solutions. And obviously, we deliver all this medication to people's homes. So I'm going to share a few case studies. One is with an app called Be My Eyes. Be My Eyes is a free app. I encourage everyone to try it out and check it out. And it was developed by a blind man in Denmark. And it's essentially like a one-way FaceTime. So there's two models. One is with volunteers and blind users, and the other is professional services and blind users. So for a volunteer, a blind user simply has to open up the app on their phone by activating it with Siri, saying, Siri, open Be My Eyes. The app appears. All the blind individual has to do is tap their screen, and it connects them to a random volunteer who is willing to help that individual. In the United States, there are 400,000 blind users and 4 million volunteers. And I encourage everyone to check it out and sign up. So basically, the blind user would, in a situation where they would benefit from some sight, connects to a volunteer who then helps them navigate a situation. We work with them on the professional side. So there's another section of the app called Specialized Help. So anytime a blind patient needs help with anything related to medication, it could be home COVID testing. It could be identifying a pill, reading instructions, and so on and so forth. The case study I'm sharing is we do a great deal of programs with Be My Eyes to help people who are blind do home COVID testing in their homes. And so it's awesome. We're able to help them identify the parts of the test, execute the test, and understand the results. Our second case study is with the Helen Keller National Center. So the Helen Keller National Center, as I mentioned earlier, is the national organization that supports patients who are both deaf and blind. We work with them and their team to actually figure out ways to help people manage their medication, even ones who are in complete darkness and complete silence. We actually are developing some technology with them now. It's a labeling system where when scanned with a smartphone, it can actually extend the medication information to a braille display. A braille display is this image that's featured on the bottom right of the screen. And it's essentially those little dots there pop up and form braille words. And so what we're able to do is someone who is deaf and blind, it can scan a package with an app that we've created, extend it to the braille display, and they're able to understand all the instructions and medication information, et cetera. Finally, this is actually a case study similarly with a deaf-blind patient using Dexcom. Dexcom is a continuous glucose monitoring system that helps people manage their glucose levels. One of the great things about the Dexcom or some of the other devices that exist out there in the United States, the popular ones are the Dexcom and the Freestyle Libre. So here was our case study. Here's our challenge. We had a patient. This is a patient who just moved to the United States from Mexico. His name is Francisco. Francisco is fully deafblind, complete darkness and complete silence. He has limited knowledge of tactile American Sign Language. So tactile sign language is essentially when an individual who is deafblind places their hand on top of someone else's hand, and that person signs into their hand. And it's a much more simplified language communication solution. But this guy, Francisco, didn't have any knowledge of this. He is diabetic and insulin dependent. He cannot read Braille. We believe, although we've not diagnosed him, we believe he also has an intellectual disability. He has no smartphone and he doesn't have internet access, and his native language is Spanish. His wife, who is his primary caregiver, is deaf herself. She has limited knowledge of American Sign Language. Spanish is her first language, and she knows a Spanish version of sign language. And she's illiterate. She can't read or write. So our challenge was we needed to get Francisco from the city where he was residing to the Helen Keller National Center in New York, where he would live for 3 months and they would train him to live independently. The challenge we had was Francisco's glucose levels were so erratic, it was too risky for us to put him on an airplane and fly him to the center. So the case study I'm sharing this with you is ultimately we were able to help Francisco stabilize his glucose enough, get him on an airplane, and he's actually at the facility right now, and he's doing great. He's progressing nicely. I'm sharing this case study with you simply because every single one of our patients is unique. And quite often when we have a situation with a patient and we deal with a problem, we're now able to take that solution and help other patients. So it's interesting, the same way that we're able to help our patients help us. So by learning from each of these experiences with these patients and helping them get to a point where they can manage their medication and manage their diabetes better, we learn and we grow. And the growth of our company is happening because, we're expanding into new territories. We add new patients every day, but a lot of our growth and the exciting growth is the qualitative growth. By solving these problems and solving these solutions and working with the patients to get them to be more compliant with their medication and to be healthier, our patients are actually part of our model that help us help the other patients as well. So thank you again for joining us, everyone. I really appreciate it. And our website is accessiblepharmacy.com. And thank you again.